What is the role of prolotherapy in myofascial pain syndrome? When we take myofascial pain syndrome as a continuum of a set of processes that involve in pain and can go further into things like fibromyalgia or chronic pain, prolotherapy is a very useful technique. It's been around since the 1960s. It was developed in the US. I trained in the US for this. But essentially what it comes down to is using inflammatory solutions that are injected into myofascial trigger points. And why would injecting an inflammatory agent into a trigger point make things better? Well, there's many different thoughts to this, but eventually a trigger point is an area of muscle that is not behaving like a muscle, meaning if you make it get inflamed, blood vessels grow into it, it can behave like a muscle again, and after being healed, you can now train it to improve. So there's many different styles of prolotherapy. Some go to where the muscle touches the bone, some are done directly into the muscle, but that would be the purview of a physiatrist to decide what kind of injection you're getting, how many you receive, and what should be done thereafter. The typical course is most people receive a series of prolotherapy injections. Once they've healed, they start an exercise program, and from there we reassess how things go. Now, what normally happens when you do prolotherapy? Over our own research over many, many years now, we see there's three types of people. So one kind, you inject them. Within one session, they're perfectly fine. They can do the exercises to maintain their body. They do, and they're fine. And some of these guys we never see again. Some people come back after a year because they got lazy and stopped doing the exercise. There's another kind. We inject them. They're kind of okay, but they're not terribly better, and it's like a 20 to 30% reduction in pain, and the pain kind of comes back to what it was before. People like that benefit from multiple rounds of prolotherapy until they get to a stable state where they can exercise, and a state where they can exercise would be a pain of 50% or less. There's a third kind. No matter what you do multiple rounds of prolotherapy, they don't improve. People like this usually have an underlying psychological issue or psychosocial stress or something that's driving up their pain. But prolotherapy is a very simple and easy technique that physiatrists learn that can really, really help sort out what type of patient we're dealing with.